So my name's Professor Kerry Arabina. I'm one of the chief investigators on the CRE, and at this webinar we're going to focus on culturally appropriate research and Indigenous data sovereignty. These are some of the core items that people in the research teams wanted us to be able to explore with them. So I'm just going to talk us through this particular presentation, and of course, as is our custom, we also acknowledge all of the traditional owners on whose lands we're meeting. And in this presentation, I'm going to talk about the overall pervasive paradigm in Indigenous affairs where this new work is happening in terms of what culturally appropriate research looks like and how Indigenous data sovereignty is being managed. I'm then going to talk us through some of the key elements of the first 1,000 Days Australia work so that you can see how we're applying some of those core values and principles through our effort and where they're landing into regions in particular. And then I'll very quickly talk through what it is that we have learnt. So as is our way of doing good research work and facilitating Indigenous governance of that work, we have a first 1,000 Days Australia Council. So all of our work is being done under the thought leadership of elders across our different knowledge traditions and within our communities. Andrew Jacomos has recently stepped down from the position because he no longer holds the Commissioner for Aboriginal Children and Young People in Victoria, but Justin Muhammad has recently taken that position up, and so he has come online with us as a member of the council. And this group of people have been completely instrumental in making sure that the cultural integrity of the work is done to the highest value for the communities of which we're all a part. So the big overall agenda of which is now setting the terms and conditions around what culturally appropriate research looks like, as well as Indigenous data sovereignty, is this notion of the Closing the Gap campaign in its second iteration, which is really looking at people's experiences and ability to contribute toward our own nation's prosperity. So this notion of refresh, resetting the agenda is becoming increasingly stronger. And what we're finding is that we've now changed discourses in policy and programmatic responses that's been in large part led by Aboriginal and Torres Strait Islander peoples. And that has taken us from seeing the deficits language and the deficits focus being pervasive in how we do our business, through to really starting to work towards achieving self-determination and advancing treaties. And even though that's happening at states across the country, it's really mobilising a lot of resources there. So what we're seeing is this real ability for both research and data to achieve meaningful change in the in the experiences of peoples. We want people to be able to change from being made childlike, where we have to demonstrate certain levels of capacities or competencies in order to be considered citizens. And we're also really changing the ideas about where we're excluded or we're assimilated in public discourse. And so now we're really focusing on advancing our own futures. And what we're doing now is really thinking about how we can have a more balanced view of who we are and how we can be together, and also then in ideas about how we're counted and who actually controls what's counted and how we're represented then in data and statistics. So in terms of culturally appropriate research, some of the ways that we really consider this work is that it's absolutely about the principles and values of good quality engagement, on holism, and things that are becoming more specific to place. And we're starting to see these challenges being addressed through regional adaptations and regional solutions. And that's because they're as close as possible to get great leverage from the scale of a public health intervention, but it's also very closely aligned to the nations of which we're a part. Some people have really talked about this new way of doing business as both bold and courageous. Not necessarily. It's actually about implementing and working through our science paradigms and privileging that knowledge tradition of our own sciences rather than trying to participate in non-Indigenous Australians' very narrow dynamic ways of considering science and science endeavour. We've really led to a much more place-based approach to what our sciences look like. And we hear this all the time, particularly from the community-controlled organisations, about the power and the importance of community-led solutions, about how to create opportunities, how to facilitate choice, how to really use research to empower families, give them back hope, And this idea then of nothing happens about us without us, this idea of undertaking research with and not doing things for or to. And that is a posture that's really appropriate for us to consider as researchers when we're engaging with community. The other thing, and I think this has happened a lot through the CRE, is that it just takes a long time to build an economy of trust. We can't go into a place and then just expect that people are going to do as we bid them to do. It takes time to develop those quality relationships. It takes time to understand what the benefits are and about how to be two-way respectful. And the ways in which we've been able to do that time and again has been when it's co-designed. That's when research actually matters. People aren't brought in just at the end of a process, when they are there at the very genesis point and when they can have opportunities to take control all the way through the research production. Oh, sorry, I'm just having a moment with my computer. There are a whole range of different guidelines that govern this work, and a lot of this is already determined in large part from the Australian Institute for Aboriginal and Torres Strait Islander Studies, through the Lower Chair Institute, and also through the National Health and Medical Research Council. And these documents are used in various ways. But basically, what we're trying to do is empower people to get the most out of a research process by knowing what their rights are and asking for their rights and their needs to be met, about taking on responsibilities to think through what the values of the ethics research process are, and then really acknowledging what the role of the researcher, but what the role of the community is in that production process. And then there's a whole raft of other values, but the six that point out and are pretty much ingrained in the ways that we do our business are the six following here, which is around things having spirit and integrity, this idea of reciprocity, so shared responsibilities, about respect and engendering and facilitating that, and also equality. It's not that we treat people like they're clients or like they're objects of our research, but it's really about engendering these ideas about equal partnerships throughout. We also have to recognise that many of our peoples are just doing what they can to survive. We think about research as something that we bring into a community, but if people are just surviving, it's actually very difficult to participate in. And there is also so much about our lives that we want to protect and keep sacred. And in that, what we have to do is really respectfully engage with these ideas and take responsible action to make sure that all of these ideas, all of these values, and all the principles are very well embedded in our research process. There is a very good book that's available for online download. It's free, and it's really referring to the establishment of an agenda around Indigenous data sovereignty. But most of this work has started off, and it's become an international movement, which is looking at the United Nations Conventions on the Rights of Indigenous Peoples, and particularly then about how we get defined and how we're represented through data and the ways in which it's collected, and how we can then use data to both own and control decision making within our own communities and not leave them within organisations. We've also got a lot of leadership that's happening in terms of these research and data-driven processes. And what we've got now is the Lower Chair Institute, which has for over a decade now really grown and supported the Indigenous research capabilities across our various communities. They have been significantly investing in building relationships, in the conceptualization of work and how this needs to be manifest and what kinds of outcomes people want to see happen. We've also had to get really important clarity around the governance of the research process all the way through. We've also had to look at information gathering, who has control of that, and then who owns it, who's the custodians for it, where and how does it all get managed, as well as who has the right and the responsibility to do the analysis of the data, and how is that meaningful for the people for whom contributed to the data collection process. There's also really important milestones that need to be recorded so that we can all learn the lessons, and that really does involve the writing process as well as disseminating or translating the evidence of those results, so that we continually can redefine what our learning experience is from the production of research paradigms. And what we've got now are a whole lot of next generation researchers who have been able to invest and engage with a whole raft of ideas that have come through from Indigenous peoples' research processes. And we've been able to not only articulate in a historical context about some of the issues that have been incredibly impactful for our community, but we've also had the chance then to think about what our lives look like in the year 2030 and what it means to live a good life at that time, and how can research actually help contribute towards an understanding of that work. So whilst we've had our own Indigenous community research institution that's now become the Lowitja Institute, we've also seen an emerging partnership between NH and MRC, between the highest levels of government plus the Lowitja research programs, to make sure that there is reciprocity inherent in the way that we do our work, and that what we're doing now is facilitating our own leadership. We're working within our own methodological contexts. We're really examining how we do our engagement with our communities, and from that we're eliciting new focus and new strategies. And we're also then creating new horizons. So what are we doing now to make an impact to 2050? And I think that futuristically ideas or concepts about what it means to live a good life, so that children being born now when they're 30 or 40 have got all of the manifestations of that around them, is something that we're really taking a great amount of pride in. In terms of Indigenous data sovereignty, we've had the incredible leadership of Professor Maggie Walters, who did a piece in the Griffiths Review that's come out recently looking at the Uluru Statement and making some suggested commentary around that. And what she did was recognise the Uluru Statement as an unbroken sovereignty, and it was a real statement about the fact that we are the first Australians and there was never a time at which sovereignty was ever ceded. He also, in this particular article, really talks about the politics of statistical production, and really makes references to data dependence and independence, and how it is that Aboriginal and Torres Strait Islander peoples get involved in setting the Indigenous data agenda, rather than just being subjects of data, and particularly those where we only get to engage because there's an identity clause or a trigger in the ways in which the statistics are generated within administrative data sets or the like. And so what we're doing then is really focusing on thinking through ownership and control, and how we can then design data requirements to meet the ambitions and sustainabilities of our communities going forward. And what we're doing now, a lot of us involved in research have unwittingly participated in describing us in ways that are to our detriment. And so what she focuses on is this 5 Ds, where we're often described as difference, and that's often put into a negative frame. Our disparity, that is the first line of every single research paper that ever gets written, where we're highlighted because of our disadvantages, where our dysfunction and our lack of engagement in modern Australian society and the normality of that is often questioned and brought into disrepute. And then the whole data which describes absolutely our deprivations. And so the kinds of data where it's housed and who collects it are currently within the government departments, and it's not even well accessed or well used, to be honest, in terms of how you actually build an evidence to practice pipeline. And so what we've got then are a whole raft of data that's held within hospitals and health centres, in justice systems, within Centrelink. But what we haven't got access to is quality data that's actually been generated from within our communities, that actually really does facilitate how we want to know what's going on for our families, and what it is that we're doing well, and how we're being successful, and what kinds of opportunities are there within our communities where we can use data to facilitate good things happening for us. And this is where we've really picked up on in the first 1,000 days to make a difference. The other thing that's really missing from the data that we need is this way of being able to recognise our diversities, to provide evidence for community level planning, where we can see the impact of those social structural issues and complexities, and how we can actually identify and prioritise measures for our agendas where we're not just the problems, and where we're not problematized, but where we've actually got an incredible amount of resilience, where we've got stated goals and where we're experiencing successes, but none of that's actually picked up in the way that we do our data collection at the moment. And so what we've got is this incredible paradox where there is an enormous amount of information about Aboriginal and Torres Strait Islander peoples, but none of it has been developed for or by our peoples for our communities. And so if we were just looking to think about how we can shift and change the ways in which we use data, what we also then need to do is change the channels of power through which those data decisions are made. And what we need to do then is really create evidence which is useful for us, and we then need to reshape the practices that allow this data to be a resource for our own communities and for our own agendas. And so what we're doing through First 1,000 Days work is really mapping not only people's access to services, but what their culture is, how they live that, what their aspirations are, how they belong to each other, and how this then contributes to our future agenda and for our nations. And so what I'm going to focus then on is First 1,000 Days Australia. It's been an initiative that started up in 2014, but really it embodies all of the principles of culturally appropriate research. It's community-led, co-designed, it builds regional research literacy and capabilities. We use culture as the intervention. We're not interested in any other policy. We train the workforce, and then we really facilitate a regional transition amongst all of the stakeholder groups from deficit to strength. And what we do is really refocus attention through data collection on hopes, dreams and aspirations. We've got local governance arrangements, and we're building now regional capabilities where people can access the data and use data differently. And we're using that to embed in policy programs and practice, and also then giving real value to culture as the intervention. What we've also done is really think about how we can mobilise this internationally, and we're currently engaged with Indigenous tribal peoples in Indonesia and with the Sami over in Norway. And what we haven't done is join up with Indigenous populations where the overarching experience of colonisation is at the forefront. What we're doing is really focusing on biological, environmental, linguistic, and the diversity of lived experiences that kind of marry up with the 300 nations that make up Australia's First Peoples. And in that, then we're finding incredible synergies in Indonesia with Indonesian tribal peoples. And although Sami are a single group, where they live across the Arctic Circle into Russia and other places means that there is an incredible amount of diversity, which is very much linked to place. And so they're the kinds of reasons why we've started off working with these groups in the first instance. It started off in 2014 with nothing really but a good idea. And it came about from a combination of things that had happened. So Tony Abbott, who was our first Prime Minister for Indigenous Affairs, was really making a big deal out of truancy and getting children to school without any consideration about the developmental capabilities of children to participate well in primary school. We'd also done a number of audits with the first ever Aboriginal and Torres Strait Islander Commissioner, who found that the children in out-of-home care were there predominantly for a number of reasons related to drug and alcohol misuse and intimate partner family violence. The fastest growing prison population in Victoria was young Koori girls. That is now being emulated in other places around Australia. For some intolerable reason, what we've done is we've kind of normalised our young men being overrepresented in incarceration rates. But when you have young women also participating in prison, what we've then got are both sets of parents in prison, which means that the transition into out-of-home care for their children is just, it's extraordinary, and it happens quickly and it happens without any question. We've also got the greatest level of public health burden of disease among 15 to 19-year-old young Aboriginal people living in regional and remote area Australia. That has powerful impacts on sexual and reproductive health, particularly around the decisions that people are using in preconception and their lived experiences in preconception, which has an enormous impact on their ability to parent well. And men are just completely invisible in public policy as anything other than a perpetrator of violence or as a a gambler or as a drinker. They're very rarely represented as having a positive or a nurturing role to play in early childhood, so we've been able to rectify that. What we're doing is also then thinking about policy setting agendas, where all of the Australian policy, particularly that focused on birth outcomes, started from birth, not from conception. So we were missing out on all of these developmental opportunities that happen before pregnancy and during pregnancy. And what we did was have a gastroenterologist who was gastroenterologist who was also a paediatrician, who'd come back from this international conference, which was a nutrition one, talk to me about the first 1,000 days. I said, that sounds awesome, but wouldn't it be wonderful if nutrition was the only problem that we had? So what we did then was focus on putting a stamp on the first 1,000 days through an MJA article, which looked at Indigenous people's broader concepts of health and wellbeing, and how we could then use this as a time-specific intervention to broaden a nutrition focus to accumulate a whole range of other initiatives under that period of time. And so what we ended up doing was indigenizing an international movement. We took the evidence from the Lancets on child and maternal health and wellbeing and about taking science to scale. I then went and did a consulting job, brought that money back into the university, and we ran a series of workshops, including pulling together gerontologists, adolescent health specialists and early childhood workers to talk about the powerful impact of this first 1,000 days across a life course. And then we designed a logo, and now we've got a whole raft of different activities that happen under the banner of first 1,000 days. And that's taken 3 years to really mobilise into a national movement. In terms of the milestones and achievements now on our research agenda, what we've been able to do is accumulate quite a few partnership grants, and we've just been awarded a targeted call on the social emotional wellbeing work. But from an idea to inception, what we've been able to do is attract now over $5 million through to doing this kind of work. We're focusing on implementation and evaluation, which is focusing specifically on those regions where people in communities are leading the initiatives. We've also got a microbiome project where we're talking about issues of biological sample collection and dynamic consent over time, and how we can influence both what people understand and how they want to be engaged in microbiome studies, but also then around how collecting institutions can really be mindful of the Indigenous protocols or ideas that need to inform that, as well as developing up a series of resources that will help people inform them about what microbiome is and why it's important for us. The other piece of work then is the international work, where we've matched what we do against the Sustainable Development Goals, and we've done a household level survey, which is not an observational study. It's around engaging then people with life coaches and mentors, particularly to get it right from the start. What we've done is use 6 prongs in the way that we do our work. So it's absolutely a research-driven initiative, but we have a policy and advocacy approach, workforce development, we do entrepreneurial activity, we do a whole raft of different things, but we always premise it around the family as being the site for developing and protecting culture, identity, health and wellbeing for our children. The other thing that's become really important for us is that we take a multi-generational and a dynamic expression of family. And so we work with 3 different generations, because we know that the sexual debut in relationships, if I can transition that just by 1 year from 14 to 15, and then first pregnancy from 16 to 17, then I've had a really amazing impact on the life course trajectory of that family over time. But the genesis point for some of the issues that occur, some of the qualities of relationships that we have, are also embedded in the parents' birth experiences and also in the grandparents' birth experiences. And so when we understand that we had 60,000 years plus of continual culture, the last 200 years have been about cultural disruption, we need to understand the trauma and the impact of that across different generations as having an impact on the new experiences of parenthood, and particularly at a time when children are most vulnerable, but there are greatest opportunities to both cut through and heal intergenerational trauma and set children up for a very good quality life across their life. The other thing that we do is use culture as the intervention. And so we're starting to really talk through the idea of pristine pregnancies. You'll never hear me talking about smoking in pregnancy. You won't hear me talking about violence during pregnancy. You won't hear me talk about nutritional impacts during pregnancy. We know that culturally, we had pristine pregnancies. There are a whole range of roles and responsibilities that come into play around that. Men have an important role to play, and so we're working through, particularly with men, about having them define for us what pristine pregnancies are and how they do this work. We've also had, for the first time in over 80 years, a welcome baby to country ceremony, which really does support that healing and cross-generational empowerment. We're really working on our Men, Our Shields, which is a very important document that talks about what children can lovingly expect from the men in their lives. We've started off at least 7 businesses now through the ways in which we do our engagement in communities. And we're really facilitating people reconnecting to country, both through microbiome work and understanding what that looks like, as well as just participating then in culture as the activities that country needs, as well as our families. And so where we're currently operating from, you can see by the black and the blue dots around here. So we're currently funded to do work up in Townsville and in Caboolture. And we've got new sites that are coming online in the Gold Coast and down at Mornington Peninsula. We're doing a lot of work at the moment with Aboriginal Housing Victoria, particularly with their tenants, and we've taken it back to a household level through their agency and their work. So as an Australian academic partner, what we've been asked to do is start and use Indigenous definitions of families that aren't necessarily biological, and we've been asked to include preconception in family formation. What we've also been asked to do is establish the first Indigenous-led and governed longitudinal study, which is not observational. So we don't do a randomised controlled trial where we have some getting tested for particular dose issues and others not. What we do is we create waves through the household level surveys. Those household level surveys also become a baseline from which we can start to understand the impact of time-specific interventions. And we've got a range of different exposures and outcomes that we're working towards achieving. And we're also then facilitating our own methods, our own data sovereignty, and about people's capability of giving continuous consent, I should say. And what we want to do is use these very time-specific interventions to show what can be leveraged and achieved through implementing these, and also then creating research legacies, which lead to scientific investigations through best practice. But also now we're getting people asking different kinds of research legacies, like, if I have a biosample or a microbiome sample upon my death, can I also leave that, as people are also leaving organs and making donations to that? Can I donate this to a collection agency as part of a biomarker for my future generations? And so these are some of the core ideas and processes that we're working with in terms of what creates the legacy. The other ways in which we're doing this work is we've got 3 really strong research themes about family health and well-being, preconception, conception and child development, and innovative practice and implementation. And the cross-cutting piece of work is the multi-generational family cohort study. And then we've got a whole range of different impacts where we're looking at life coaching, welcome babies to country, early childhood and family centres and the impact of that work, as well as family and small business development and entrepreneurial and innovative thinking in the first instance. So we've got a number of regional sites that we've talked about. There's been a lot of preparation and development work go into those regions to build them up to scale. And we do that through a range of different ways. But predominantly what we've invested in are regional implementation managers who are employed through the universities, co-located within organisations to do a lot of the implementation and coordination work. And here you can see examples of where we've got family people who are co-designing with us the household survey, where we've used peer researchers, and we've got now an accredited course where people can train up as peer researchers to go out and do that. We fund them to do that work. We've got men's groups who've started up. They've also set up businesses, and we've been able to use sponsorship monies to help build up resource capabilities which are specific to their locations. And what we're doing now is a couple of key distinct evaluation pieces. The first one is having a look at service integration of early childhood centres on Palm Island and in place called Toronto, which is near Newcastle. And we've also then got a research collaboration, NHMRC funded, with child protection agencies, chambers of commerce, evaluation and implementing scientists, peak bodies for childcare centres, Save the Children and Aboriginal housing cooperatives to have a look at the implementation and the impact of the first 1,000 days piece across our different regional sites. And we've got a key range of researchers there. We've also got this microbiome project that was funded through from the Lowacha Institute. We've spent a whole year now really focusing on implementing interviews with 12 family groups across different generations about their early life pregnancy and birthing experiences. And this is also then helping people record the stories of these birth experiences across different generations, but also helping to connect them into country. This has been the subject of a recent media release and a media story. Sharon Hubner's doing that work. She's a family historian and has worked a lot with Link Up, so connecting people to each other. And now we're using this work to connect people to place and across time too, which is just extraordinary. And the information that we're learning from what it is that people understand microbiome to be and what they want and how they want this information collected is just going to develop up a really strong protocol that we can then use when we do some of the biological sample collections. Here's some of the work that we've been involved with our partners in Indonesia. We've taken our leaders over to there and we've invited this group to come along to a summit. There's particular interest in nutrition and mapping against the Sustainable Development Goals and the ideas around bush tucker and medicines and what that can do. And then with the Same people, we really have been up to the Arctic Circle on a number of occasions. We've now got a project that is a similar styled project operationalising through these places called neighbourhood centres, and this work's now being funded through the Parliament, the Sami Parliament, based up in the Arctic Circle. And what we've done is had a couple of different cross collaborations where we've had university visits, and they are looking at the implementation of language from grandparents and using that as a mechanism that is really about cultural revitalisation during this very time-specific intervention. We're also then responding to Aboriginal and Torres Strait Islander family aspirations as a way of being able to fostering self-determination and a social emotional well-being. And this has come about through a recently awarded NHMRC program and builds on the household level surveys and the intervention that we've done with Aboriginal Housing Victoria. At this point, we piloted life coaches and mentors as being able to help people really realise their aspirations. And our early work has shown that we've now been able to achieve over 200 life goals in a 4-month period by employing 2 life coaches, and it's just been tremendously impactful for the families who've participated. So what we're doing is evaluating the short, mid and longer term impacts of a life coaching service and how that's actually really helps builds a sustainable future for our families. And then we're also describing the patterns and trends in measuring these outcomes over time amongst children and their parents who then opt in or opt out of the life coaching service. And so in terms of the ways in which we're doing this implementation, it's through a aspirations-focused household survey where we've developed over 50% of the core variables, and people are okay with that because we know that we need to compare and contrast across different countries and with different nations. But 50% of them are also then in partnership with the regional site according to the families and the local service providers and local government. And so we've involved all of these people because we know that the service response is going to be markedly different. We've learnt a lot through the work that we've done with the More Than a Landlord project, and we had a range of different key indicators that we were able to do in this piece of work. And what we also did was then train up tenants who themselves were single mothers who wanted the opportunity to transition into work. We paid them $33 an hour for a 6-week experience. we then helped them develop up their resumes. We did media training with them. We put them in front of politicians. They now come back and do teaching into our master's courses. We've set them up with ABNs, so now they're being used by other government departments who want to work with that group of people in housing, and they're now coming back as this next cohort of trainers who are going to facilitate the training for the next lot of peer researchers. And what we've done then is really brought people along a journey on developing up these survey tools and making sense of what it means for them. And so in the Townsville area, there's going to be a strong focus on what happens during miscarriage and the experiences of both men and women who miscarry pregnancies. In Victoria, they're interested in service delivery responses and what the experiences are of tenants in households, in that what makes a house a home. And then in Moreton Bay, they're very interested by service utilisation and where are people actually plugging into services where they can really get some help and support during those very early life experiences. And so what we've done now is build this whole way of being able to work, which isn't about managing cases, and it's not about doing social work or counselling interventions. It's around working with every person in that household from age 14 and up, where we identify the hopes, dreams and aspirations of people from age 14, as well as then the hopes, dreams and aspirations that parents have for their children. And then we hook them up with resources where they can actually facilitate their own health and wellbeing and achievement of those goals with a life coach together. And in terms of that, what we also believe then is that we've really cut through and created Indigenous data sovereignty, and the practice of that is now being evident in our work, in that it's been designed with people. We're now developing up with Save the Children and through the Australian Indigenous Leadership Centre 2 certificates. One is a certificate 2 being a peer researcher. The other then is a peer researcher coordinator, which is a certificate level 4. And that will then help facilitate and build research capability and literacy within communities and within organisations. Our local agencies, through the arrangements that we have, control who accesses the data. It's an income generation capability for them. They also have an ABN workforce where they can brokerage with other community or information seekers with their peer researchers who can then come back and do further household level engagement with them. We're looking at the issues of dynamic consent, who can opt in and who can opt out, when, how and why. And we're also then really formalising these approaches within the regions that we're working, and we're really training services to consider research differently. The other thing that we've been able to do, which I think is really speaking a lot to Indigenous data sovereignty, is we've really changed the game in terms of how our men are represented, particularly in this early life experience. So rather than being referred to as the floggers and the bashers of our women and children, people who are not paying up on their payments for their partners, what we've really spoken about then is the Our Men, Our Shields document, which really does talk to the kinds of things that children should be able to expect of men and their families. And it is a beautiful statement. People read it and cry. It just really does change the nature of the relationships that we can have with our men during this very important period of time. And the other thing that really does govern how we do our work is the Charter for Rights of Children Yet to be Conceived. And so what we've done is really privilege the voices of children to talk about the kinds of families that they want to be born into. And as a result of that, what we've done is just really given these men, particularly in Caboolture, just a small opportunity to think about early life and how they want to be invested in this. They are now really part of the Welcome Babies to Country programs. They are leading Ochre Day campaigns, which refers to the ideas around family violence and how that can be better managed. They are working in solidarity, but also alongside our women and children. They are just becoming engaged in so many different forums and developing up resources and creating a mainstay, which is really healing in practice. And all of this has come about from the information now that we'll get from that household level survey will really feed into how this group can become more sustainable over time. And there's a real strength in solidarity amongst this group, which we haven't seen before, and it's across different generations. And so in terms of that, I'm hoping that what I've been able to do in a very short space of time is give you an idea about the first 1,000 days, how we've been able to think about doing culturally appropriate research and how we're enacting data sovereignty. We've also developed this into a series of non-award courses. The second one that we'll be running next year will look at going out to the regions where the data is available, and we're doing things like question storming sessions. What kinds of questions do you want to ask from the data, and then taking people through how they can have a look at it and then what it means for policy and practice. And then the other thing that we've got now is the master's degree subject, which is focusing on first 1,000 days. And we take people on an intensive week-long program for that. The 2 days that we do in regions then leads into the master's degree subject. And then also by the end of this year, we should have accredited then and deliverable, available for delivery, 2 courses which focus on being a peer researcher and then also how to coordinate peer research activities going on in different regions. So thank you very much for your time. If you have any questions, you can contact me either through Twitter or through the web or email. If you'd like to follow us on Twitter, we put up a lot of information all the time, and we go out to different places and you can just see what's happening. There's also some Facebook pages which are specific to the regions where we're doing this kind of work. But I wanted to say thank you for your time, and I hope this has given you some good information about culturally respectful and responsive research and Indigenous data sovereignty. I'll leave it there for now. Thank you. And we're done.